Welcome, everyone. We are live on Instagram and about to be live on Facebook as well. And if anyone anywhere cannot hear me, please let me know. I am thrilled to be here. It is Sunday night. It's been a beautiful weekend in Atlanta. How about you guys? I hope you guys all had a fabulous weekend. If you don't know me, I'm Dr. Taz. I'm an immune support and wellness doctor, and I live my life by my passion, which is to empower others into being their most superpowered self. Now, of course, this whole pandemic has been challenging for me because it's been really having to take in a lot of negative information, right? The world feels like it's collapsing. So many negative things seem to be happening. But at the end of the day, we want to stay hopeful, positive, happy, and healthy. And that's how Sunday Night Live was born. It was born to really break these headlines down, really spread messages of hope and encouragement, and help everybody to realize that at the end of the day, we do have power, and that power is in our hands to control our fate, our destiny, our health, and how we react to any situation, including this pandemic. All right, let's get to it. Let's break it down. I always love to start all of these lives with a quote. And if any of you are tired of my quotes, I'm so sorry, but I love them. This is one I just shared on my private Facebook group as well, but I thought it was so appropriate. Let's get rid of that. I thought it was so appropriate because it's from Winston Churchill. Success is not final. Failure is not fatal. It is the courage to continue that counts. So this pandemic has done a number of things to all of us, right? For some of us, it's been an opportunity for quiet time and for creativity. For others, it's been a chance to reconnect with family and friends. I know I've tried to do that. If you've been watching me on Taz and Friends and have tried to do it personally as well. For some, it's been a little bit tumultuous, right? You might be a business owner, you may now be unemployed, you may have had a financial catastrophe or a health catastrophe, and you're really trying to dig your way back out of it. But I want you guys to all remember this. It is the courage to continue that counts. And that ultimately is the best game changer when it comes to anything that we're dealing with, right? I know that most of you would agree with me for sure. So keeping that in mind, let's get into some of the headlines. Let's do one fun story. You know, I love the memes. How fun are all these memes? And I still haven't figured out the technology of putting something up here so you can see this, but there's so many fun memes. But this one I thought would be appropriate. The year is 2075. Grandma, why do you like sitting outside? You ask. Me, there was a time when this was illegal. I thought that was funny. And then the other one was, I don't know if you guys have seen it, where there's social distancing in the refrigerator with the Corona beer off to the side, sitting all by itself. All right, gotta laugh at some of these stuff, but let's put all jokes aside and really talk about some news. I start with a patient story. This is a true story from the exam rooms. And, you know, usually I share stories of how people have reacted to COVID, either within my practice or that I've heard of, and how dealing with your immune system really matters when it comes to this particular infection. And today's no different in today's patient story, but with a twist. So this is a patient that I've known for a really long time that was going through an incredibly stressful period of time over the last 6 to 8 weeks. And around that time also caught COVID. Well, she did get sick. She did have a lot of respiratory issues. She recovered from COVID. But what COVID did, like what we see in practice so often, is it triggered some sort of autoimmune chronic inflammatory response. And that in turn continues to cause her trouble. Sometimes shortness of breath, sometimes achiness or joint pain or brain fog. And she's having trouble and of course panicked that she's one of these complex COVID cases. But I share this story with you to help stress the relationship between two fundamental concepts. One is that your immune system matters. And the second is that your immune system and this concept of inflammation are intricately combined and interlinked together. You almost can't talk about one without the other. Now, how much more obvious is this when it comes to the headlines from the last few days, where we were primarily talking about children and COVID-19 and that cluster of cases in New York and Italy where children with COVID-19 were developing something called Kawasaki syndrome. Now, I haven't seen Kawasaki syndrome since my early times in the emergency room and residency, but Kawasaki syndrome is an inflammatory disorder where your blood vessels get inflamed. So again, the connection. COVID-19 is a viral trigger for a chronic inflammatory process. So how do we protect our children? I know that's on everyone's minds right now. I know that's been dominating the headlines. Well, here's the good news. The good news is that we want to make sure, again, we support and prime our children's immune system, and we decrease their risk for chronic inflammation. How do you know your child has inflammation or is at risk for inflammation? Well, there are a couple of key things to keep in mind. Here are some of them, some of which may surprise you. First of all, if your child has a tendency to be overweight or underweight, they may have chronic inflammation. Here's the reason why. We know that weight in itself is inflammatory, and more children today, unfortunately, are struggling with weight than at any other time before in history. So weight is a problem. They're more sedentary. They're on these devices. It's driving me crazy, but they're on these devices all the time. It's hard to even get them outside to play. And then in many schools, at least here in the United States, they don't have the physical education time that they once had. So weight is a factor. Now, the underweight is just as much of an issue, because when you're underweight, you're usually not absorbing. You're not holding on to nutrients. You're not holding on to things. And that in turn can be a cause for chronic inflammation. So the two are linked. Look for weight in your child. Where is it? If your child has asthma, allergies, acne, eczema, these are all signs of low-grade inflammation. So you do want to make sure they have a healthy gut, they're taking the right nutrients, they're getting a little bit of support with greens and high antioxidant foods. And those are the kids probably, quite honestly, from what I've seen in practice from over the decade, they need to be maybe on some vitamin D and vitamin C and one of those immune boosters like astragalus or umca, some of the herbs that we talk about over and over again. So a lot of this information is on my pages. You guys can find it. It's on my website, drtaz.com. We have that whole immunity guide that you guys can use to refer back to, but it applies to children as well. So again, don't live in fear of the headlines. Let's get empowered. Let's get called to action and learn to link together your health, your immune system, and inflammation, and how paramount and critical those factors are when it comes to determining outcomes. So we'll continue to keep an eye on what's going on with children. I do know that they are getting affected mentally as well. So the whole mental health issue of our children is becoming more and more of a conversation, with PTSD, anxiety, depression, more screen time and electronic addiction, all becoming bigger public health issues than they were before the pandemic. Meanwhile, the race for a treatment. So this is slightly comical to me, and just in terms of how everyone's like racing and rushing, and it's almost like who's going to be on first. I hope they're trying to be accurate. That's like my hope. But lots of studies out. I was reviewing them today. There's actually a clinical trial in place to test out the combination of hydrochloroquine and azithromycin. We continue to get conflicting reports on that combo and whether that combo is effective for wiping out COVID-19. There's some new research on something called interferon alpha 2B and some promising results there. Remdesivir, which is another one from the company Gilead that we talked about last week, is also a potential treatment alternative. And a couple of other companies, Sorrento, another Russian drug company, working as well. And then there's this rumor across the board about plasma therapy. Have any of you guys heard about plasma therapy? I'm not sure if any of you guys have heard about that or talked about that at all. Plasma therapy is where you take the plasma from one person who's had COVID, and then you inject it into somebody that hasn't had it, and the hope is that you mount an immune response. Don't know the science on that, so please don't go do that. But these are all the things that are floating out there right now. The race for a vaccine, lots of conflicting information about that. When is a vaccine going to be here? Is it going to be a vaccine that gets us open? I don't think that's the answer to get us open and back to normal. I think we're going to have to own reopening and getting back to normal and putting in the right sort of cautious measures, the right sort of, things to help us, get back to normal in a good way. So the vaccine thing I'm following for sure. I'm just concerned that it's not the ultimate answer that everybody wants, because when you rush to get a vaccine out there, oftentimes you don't take into account the fact that the vaccine mutates, that it changes, that it can outsmart us. So where am I going to land with this? You guys that follow me know I'm going to land back at Your immune system matters. I feel like that needs to be like a slogan. Immune system matters. It really matters. And it makes a difference in your overall health and your outcomes, not just to COVID-19, but to so many other conditions. In fact, this week, I think later in the week, is Autoimmune Awareness Day. And autoimmunity and diseases of immunity have skyrocketed. I mean, they're out of control. And so I think we have to keep in mind that, as that was anyways a global issue of its own, now with COVID-19, and like I was talking about with my patient, that ability of these different viruses and toxins and things like that to trigger a long-standing immune or inflammatory syndrome is something that's very real. So we start back at taking care of ourselves, at managing our immune health, which means managing your diet, your sleep, your stress levels, making sure you're getting the nutrients you need, and understanding, as people fight about whether you supplement or not supplement, that the quality of our food today is not what it once was. So many of us, due to genetic mutations and food quality, need additional supplementation. So in the context of coronavirus, we're talking more about D, C, zinc, and selenium. In other cases, it needs to be an individual conversation that you have with your doctor and a screen to make sure that you're on the right things for you. All right, so keep that in mind. And I talk a lot about D and C, but I don't want you guys going rogue and just randomly doing stuff. I mean, it is important to ask for some of these things to be checked when you're in your doctor's offices. These are things that we know work, and the research is coming out. All last week, we had research on vitamin D and how critical it was for the immune system. So keep all of that in mind. Let's see, we're getting a comment. And remember, feel free to introduce yourself. We are live and we're having fun. And I'd love to know where all of you are from when you're joining me. And if this topic is really boring, then we can talk about something else. But we did that little quiz, and most of you want to talk about your immune system. I think that's number one, with weight loss being not too far behind. So let me know who you are and where you're from. And again, I hope you guys are all doing well, no matter what part of the globe you are listening from today. All right, I have something from Mitra. It was very scary to try a vaccine for this virus that we don't know too much about. I'd rather boost my immune system so I can fight it. I agree with you. I'm with you 100%. I think that we want to test vaccines. We want to be cautious about vaccines, and we want to work on our health as much as you can. And you're from Columbus, Ohio, so thanks for joining me. I really appreciate it and hope that you're getting valuable information as we do these different lives and have these conversations. Anyone else who'd like to introduce themselves, please go ahead and join our chat and ask your questions. This is time for you, and this is so much fun and an honor for me. All right, let's keep moving here. Actually, it brings me right to weight. So weight and the connection with weight. Now, I talk a lot, and this show to me is really a show about merging medicines, right? Really understanding the whole way forward, because we get a very conventional Western view a lot of the time, or we hear this Eastern view, but it doesn't sound like it makes 100% sense, right? But when you merge the two together, I have found in practice that it is an amazing, powerful prescription for healing, for solving medical puzzles, but also for helping you find your superpowers. Because in Eastern medicine, they connect who you are with your emotions, your personality, your health risk, how you even conduct yourself in a family or a work situation, and so much more. The Western medical model is beautiful in terms of technology and lab work and precision and research, but it doesn't tie the emotional, sort of the energetic piece into it at all. And the two have to merge, because we as human beings are not isolated in a box. We have to be able to account for all of that. So I think the East-West way is the whole way to medicine. I think merging medicine is ultimately the answer. And it is my life's mission to see that become a reality for everybody, no matter where you are in the world. All right, let's talk about weight then from that context. So many people are dealing with weight gain, at least folks that I'm talking to. The average weight gain has been right around 7 to 10 pounds. Some people are calling it the quarantine 15. And we know there's so many different reasons for that. It's like a bake-off in any home that you go to right now. Everyone's cooking. It's like holiday season all year round. And worse, we're not moving that much, right? Many of us are trying to do the workouts online or walking or things like that, but still not getting that constant daily movement that is so critical to weight loss and maintaining low body fat. And there was actually a study that came out talking about, this was from Oregon State, that talked about online exercise advice is not really aligning with National Physical Activity Guidelines. So we need to move more and sit less throughout the day. So for health benefits, we should complete about 150 to 300 minutes, which is about 2.5 to 5 hours of moderate aerobic activity, or 75 minutes of vigorous aerobic activity every week spread across several days. So, that's devoting at least 30 minutes, right? A day, at least 3 or 4 days a week, to significant activity. And by moderate, they mean like a brisk walk at about a pace of 3 or 4 miles per hour, where you can still hold a conversation. So those are some of the things that we're finding when it comes to the conversation on weight loss. Let me take a sip of water here. So that's a study that just recently came out. And then the other part of weight loss is needing muscle confusion. So we're not going to lose body fat when we keep doing the same thing over and over again. Unfortunately, that's actually going to help us just hold on to body fat because the muscles are not having to work. So we want to create a situation, no matter what workout that we're doing, where we do have muscle confusion, where different muscles have to work at different levels of intensity, and they aren't just doing the same thing over and over again. And I think that's what I run into sometimes, because I get busy, so I do the same yoga workout or the same walk. So I'm challenging all of you out there listening today to do what I did yesterday and try something you haven't tried in forever. So I finally picked running back up for the first time yesterday, which I haven't done in 20 years, because so much of my running has a lot of emotional stuff around it, like being in med school and being really stressed and getting sick and all that other stuff. But now that I'm hopefully wiser and a little bit smarter, I'm going to run, but still not do it excessively, but see if that's a way to create muscle confusion so my body starts to respond, especially when I can't get to hot yoga and some of the things I love to do. And I'm also doing more weights and doing more weight training, because fatiguing those muscles is essential to losing body fat, especially in the context of us sitting more. And speaking of sitting, get up and move around. If you're working from home, if you're doing a ton of Zoom calls, try to set your alarms, get up like maybe every, a couple of hours, walk around. I'm so guilty of this too. I'll get into a zone and not want to break what I'm thinking or writing. But again, that's not good for our metabolisms. We want to do whatever we can to improve our resting metabolic rate. So that's another clue there, is move as much as you can, confuse your body, change your workouts. I think I put on Instagram, adapt, challenge yourself, and then repeat the whole thing all over again. So adapt, change, challenge, repeat, and keep yourself sort of cycling through that as much as you can. All right, reopening. How are you guys feeling? Everybody ready to get back out there, ready to do this and live life? So I actually printed off the CDC's guidelines for reopening, and there are a couple of things in here I wanted to highlight. You guys can go into the CDC website, cdc.gov, and download these yourself. But there are a couple of things, in case you don't have time for that I wanted to make sure I call your attention to. So the big thing with reopening is everyone observing hygiene, right? So that's personal hygiene, workspace hygiene, business hygiene, all of those things. Each of us, whether you're a business or you own a space or you're just an individual getting back out there, want to develop a plan of action for your hygiene, and you want to maintain and revise that plan as is necessary in the environment that you're living in. So the first part of that is really personal hygiene. So wearing face masks are now universally recommended, wearing gloves as well, wiping surfaces down, which we'll get to in just a minute, washing your hands are probably the mainstays. The next is, of course, not being in super large crowds. I think you've heard everyone, including your governments, talk about that for sure. And then it gets a little bit more specific. And it says the virus that causes COVID-19 can be killed if you use the right products. So the EPA, the Environmental Protection Agency, has compiled a list of disinfectant products that can be used against COVID-19, including ready-to-use sprays, wipes, and concentrates. And you can go there, I think it's just epa.gov, and find that list of disinfectants there. So that might be helpful information for people a little bit hesitant about reopening. Now, regular soap and water does kill the majority of germs and helps prevent the spread of the virus. If you can't find one of these disinfectants that are approved, the recommendation is 1/3 cup of bleach to a gallon of water, or 70% alcohol solutions help to disinfect different environments. You don't want to mix the bleach with a different disinfectant. That can be dangerous and cause fumes, right? So don't do that. But this bleach combo with water or a 70% alcohol solution functions as a good disinfectant. Now, a couple of interesting facts to review in case you're curious. Coronavirus on surfaces and objects die within hours to days. All right, so different than what we were hearing, that coronavirus lives for weeks on end. It dies in hours to days. Warmer temperatures and exposure to sunlight reduce the time that coronavirus survives on surfaces and objects. The other interesting, there's one more thing I wanted to go over here. So cleaning surfaces, you want to clean with soap and water. If there's not the EPA approved disinfectant, then use the bleach combo or use the 70% alcohol program, 70% alcohol solution. And there was a list of certain surfaces that they recommend disinfecting, and those includes tables, doorknobs, computer keyboards, light switches, that's another commonplace, taps on faucets. Let's see, what did I miss? Anything else? Phones. How could I forget the phones? Phones are another one. Gas pump handles, touch screens, and ATM machines and countertops. So those are things you want to be able to disinfect with this particular solution. So keep that in mind as we're heading back out there. And then I also thought it was interesting in here, they talked about swimming pools. They don't think it's going to be a problem in the pool. They said no issue in pools, hot tubs, or spas. More of a concern on playground equipment. I thought that was interesting because oftentimes those spaces aren't maintained as much. So interesting fact there, that as we head into summer and the beach and pool time, the pools, hot tubs, and spas are not as much of a concern there. So at the end of the day, these are the key behavioral practices: social distancing, 6 feet away from each other, hand washing, face masks or face coverings, not touching your eyes, nose, and mouth, and then, of course, staying home when you're sick, and then cleaning and disinfecting surfaces. So those are the CDC guidelines. I'm going to add just a couple more, which, remember, is your immune system, really thinking about your immune system, protecting that immune system of yours, managing stress and sleep and your nutrition and your gut health. Those are the mainstays of good immune health that helps to augment T-cell mediated immunity, so that even if you do get exposed, you don't go into cytokine storm, which we've talked about here before, and your body can mount the appropriate immune response. So again, your action plan, it's time for that. Merging Medicine, you guys ready for your action plan? So here's what we want you to do, or I want you to do. All right, manage your food. Who knows what the right foods are? Raise your hand. Oh yeah, I can't see you, but anti-inflammatory diet, lowering sugar, lowering gluten, lowering dairy. Those are inflammatory foods. They put more burden and strain on your immune system and make it harder to fight. So diminish that. Increase, on the other hand, high antioxidant foods, your leafy greens, your berries, high vitamin A foods like carrots and sweet potatoes. Those all help the immune system by providing the antioxidants and the vitamin A and vitamin C your body needs to fight infection. All right, so your food matters for sure. Getting those healthy fats in so that you do have good vitamin D production is important. Fatty fishes, fortified dairy, those are ways to get your vitamin D in, nuts and seeds. Now, the darker your skin is, you often have more trouble absorbing vitamin D from the sun. So many people think, well, I'm out in the sun. Well, you could be out in the sun, but you may not be absorbing and converting vitamin D. So keep that in mind and maybe get those levels checked so you know where you are. All right, your stress. So much of modern medicine is about stress and its toll on the immune system and on inflammation and on so much more. So please keep that in mind as well. Manage your stress. It's a stressful time, lots of change, but grab that change and remember, you're not going to fail. You're going to have continued persistence to take things to the next level. So manage your stress, find and build that stress toolbox. We talked about the anxiety toolbox last week, and that video is up too, I believe, both on YouTube and on IGTV if you want to check that out. But find ways and strategies to help you really manage your stress. So keep that in mind. Your immune system we talked about. Now, the next step is augmenting that, right? So you may need supplemental vitamin D, vitamin C, zinc, astragalus, these are some of my favorite antiviral herbs. These are all things we need to be thinking about as we move forward. And those help the immune system. If you start to feel bad, you can double up on some of these things. But of course, always check with your doctor because I at least don't know your personal history, but these are things that we've seen work in practice. All right, last but not least, a couple more things is exercise, right? Movement is key. We've talked about that today. It's going to help you manage stress, and it's going to also improve the quality of your sleep. So that's something you can bring in to your regimen as well. Some of my favorite ways to exercise while we've been in quarantine, I've been doing a lot of Zoom yoga workouts and a lot of YouTube videos for different muscle groups, and then using equipment that we have at home, whether it's an elliptical or a bike, and then trying to walk, and then now trying to run. So try to challenge myself just as much as I encourage us all to challenge each other. All right, if you guys have any questions, please post them and I will try to answer them. I know we're getting a lot over here on Facebook, and I promise I'll try to get to those in a little bit. So ask away if there are any questions. I don't think there are any from my Instagram community. Do we see any questions here? What Eastern medicine am I talking about? I'm talking about Chinese medicine and Ayurvedic medicine. I'm trained in both those disciplines of medicine. They bring so much value to the Western medical model, and that's why I think merging medicine is the whole way to medicine. I think that provides us with the answers, completes the puzzle, solves health dilemmas, but most importantly, brings people back to themselves. It really helps them find their superpowers. And I've seen this in action. I've seen it in practice. I've had my practice now for over a decade. I think I've seen over 15,000 patients. It has been a privilege and a gift to watch them bloom, grow using this methodology. And I want that for all of you as well. So keep that in mind. All right, the week ahead, let's talk about what's coming up, because every week there's exciting stuff. We're headed into summer. Memorial Day is right around the corner for those of us here in the US. It's just an era of positivity and optimism. I know I'm excited. I hope you guys are too. And let's think through what's going on here, at least in the Taz world. So Taz and Friends coming up on Tuesday, and then we've got 2 on Friday. So watch for the announcements on that. I believe I'm talking to 2 physicians, Dr. Whitney Bowe, and then on Friday to an amazing chef in California. So looking forward to their perspective and learning how this pandemic has affected them. If you know someone who would be a good person for Taz and Friends, please encourage them to reach out to me. I really want us to be a global community united in our understanding of how this pandemic has affected each of us. So Taz and Friends coming up on Tuesday and Friday this week. A new podcast episode on Spotify will drop on Tuesday as well, so check that out. This week's episode is going to be a good one, right? How has this pandemic affected your relationship? So I talked to James Sexton, talks about the staggering divorce rate here in the US, and I know it's climbing around the world. I think he said we are at 51 or 53%. I don't remember exactly, but why does that happen? And how do we all stay in love with our partners, stay together to have that strong relationship? I know the pandemic has tested some relationships, has strengthened others. It's been pretty fascinating. It's been a real return to you and your authenticity and understanding, you know, the motivation behind everything, right? Behind who you're with, your actions, your health, and more. So that's coming up on Tuesday. And let's see, do I have anything else coming up during the week? Yes, I think I'm going live on Headline News on Wednesday. So I'll make that announcement too. So that'll be a fun, something fun as well for all of us. And on Thursday, I believe it is Autoimmune Awareness Day, a really important day for my patients and the folks I treat, as so many of them have battled autoimmune disease. And the links are things like COVID, other viruses, chronic stress, toxins, hormone imbalances. So we'll be talking a lot about autoimmune disease and inflammation in the days ahead. All right, I think that wraps it. I'm right on time. Look at that, right at 9:30. I love it. Right on time. Thank you for joining this episode of Merging Medicine, trying to lead people into understanding the whole way to approaching their health, their wellness, their lives, connecting the dots so that we all stay superpowered. Have an amazing night. Have an incredible week. I will see you guys soon. Take care.